My name's Talman Strammel. I'm a neurosurgeon who's been practicing at Hendrick for 8 years. I completed my neurosurgery training at UT Southwestern in Dallas in 2007.
My name is Dr. Bonnie Hayashi, and I am a neurologist here at Hendrick Medical Center. I've been here at Hendrick for 2 years now. I train at Baylor College of Medicine in Houston.
My name is Matt Cope, and I've been here 4.5 years now at Hendrick. I grew up here in Abilene, then I went away to Baylor College of Medicine in Houston for med school, and did internal medicine training at Duke, and came back here. Now I'm working as an internal medicine hospitalist.
So my name is Joji Varghese. I'm one of the interventional cardiologists at the Hendrick facility. I did my medical school in India, and then I came over to Springfield, Illinois, and I did my residency and chief residency there. Then I moved to Temple, Texas, and at Scott and White, I finished my cardiology fellowship, and I worked as a hospitalist there for a year also. Then I moved to Little Rock, Arkansas at the University of Arkansas for my interventional cardiology fellowship, and after that I came back to Abilene.
I'm Catherine Reinert. I'm a urologist here at Hendrick Medical Center. I work for the Hendrick Provider Network. I've been here for almost 3 years, and I'm from Abilene. I grew up here, and I went to Wiley and then Abilene Christian University. I moved down to Galveston for medical school, and then went to Lubbock at Texas Tech for my residency training, and I'm happy to be back here in Abilene.
Hendrick Medical Center has really extraordinary facilities. We've just upgraded the operating room in the last 2 years to now a state-of-the-art. Over the last 8 years, the hospital has been very supportive in building this service line of neurosurgery, which obviously requires very significant equipment outlay, and we were able to essentially duplicate the operating rooms that I was trained in at UT Southwestern out here at Hendrick. We've had very good support with from the administration as far as equipment needs, and I would stack our operating room against any operating room that I've been in around Texas.
The facility is great. We have all advanced technologies here. I can get the MRI of the brain done very quickly in 15 minutes, so that's the best part of being at Hendrick.
Since I'm a proceduralist, I work in the cath lab, so I think definitely Hendrick is a great place to work, and it has many state-of-the-art facilities. Believe it or not, I have so many friends working in many big cities and many other hospitals. The level of equipments and procedures we do here is comparable to many places.
So even though I've had a long history of knowing about Hendrick Medical Center, my first experience was back in the early 80s when I was born at the hospital. I've always known that Hendrick has had a great reputation within the community, and now being back here as a physician and a surgeon, I've been very impressed with all the upgrades with the facilities that are constantly being made. We have up-to-date technologies in the operating rooms, and the staff here is just amazing. Everyone is very focused on patient care, and it's everyone's top priority making sure that patients have a good experience here, and that their well-being is our number one priority.
The nursing staff is great. I feel like we have a large percentage of our nursing staff that has been here for years. We get to know them very well, and I trust them. If they tell me that I need to come see a patient, I know that I really need to come see a patient. And I just think that there's overall just a good rapport and friendship amongst the nursing staff and the doctors, and we work really well together.
The nursing staff, I would say, definitely that is one of the things I like about Hendrick, because I tell the nurses, we do see patients for probably 5 or 10 minutes in a day, and rest of the 23 hours and 40 minutes or 15 minutes, they are with the patients, so I have to trust them to make the decisions. I would say one of the floors in Hendrick, especially C6, they have incredible nursing staff there, and I would say probably one of the charge nurses there is one of the best I have ever worked with.
I'm in a group practice. I came out in 2007 and started a solo practice. I then had a partner join me in 2 years, and then we brought on another neurosurgeon 4 years later. So now there are 3 of us. We are independent, but have a very close working relationship with Hendrick. we're able to reach out to the outside communities very easily with this model and gain very good personal relationships with physicians of all different practice types throughout West Texas.
So I am hospital employee. I work on the production model. That is great because I have a lot of flexibility, and I think that the hospital is very open to all kind of practices. So I think that you have a lot of flexibility with Hendrick Medical Center.
So the practice model that I'm in, I work for the Hendrick Provider Network. I'm the only urologist currently employed by the Provider Network. We have some other physicians that will be joining the urology practice soon. And when I was looking at different practice models as a resident, it's really hard to know because you don't have any experience. But as a urologist in a subspecialty that needed a lot of equipment and right off the bat needed a lot of ancillary staff, I've really enjoyed being part of the Provider Network and having that support that I needed. I was able to come in into a fully functional clinic without having to worry about how am I going to purchase the equipment, how am I going to pay for my staff, but instead I was able to come in and right away focus on patient care, and that's been a really big asset. I've also been able to be involved with most of the big decisions that are involved in the clinic and in my practice, and I've really enjoyed working with our administration to help further our department.
We service an approximate 400 to 500,000 patient population out in West Texas that covers 19 counties. There is significant space between each of the communities. When I came out, I spent time with the liaison, who is now Brett Emmett, reaching out to these communities. I spent 4 days, one day going north, one south, east, and west, and immediately when I began my practice, I had basically a full clinic.
So when I first started, Brad took me out to meet all the physicians, all the providers, and now I get to know them very well, even on a personal level. I have had doctors from other counties call me and say, hey, what I should do with this patient, and I have received a lot of phone calls and say, we would like to admit the patient to Hendrick Medical Center. So we have a very strong relationship with those counties and those providers, and I do receive a lot of stroke patients from all these 19 counties. So Hendrick serve a very big area.
I think that visits help me a lot in this, in the sense, I get more referral and tell them, I tell them, look, you are out in the community. Sometimes they are in the middle of nowhere. If you have patients you are struggling, send us over. We'll take care of them because we have a more comprehensive group here and more facilities here. We can take care of them.
With Hendrick being a small local community hospital instead of being part of a larger healthcare system, we have a lot of advantages, and it's something that as a resident you always think about how the administration is going to play a role in your practice. But now that I've been here several years, I can't imagine being in another healthcare system. If I have a problem, I pick up the phone. The administration is always there and eager to help. They're always looking at patient care and patient safety and patients' well-being as their top priority. In talking to other colleagues of mine that are maybe in larger healthcare systems, they run into some different roadblocks that I fortunately not had to encounter because we're in such a smaller community where we're able to focus mostly on our patients, and making money is not the bottom line, but we have a culture of caring here.
Anytime that I need to talk to the CEO, I can make an appointment and sit down and talk about any issue that I have. The Board of Trustees are also many people that I know personally from the community that are also reaching out to me, and we have conversations in social events about various aspects of the hospital. Those relationships are very important whenever you're trying to plan and build a service line or a large practice.
So one of the benefits of being in a smaller hospital like Hendrick is I pretty much know all of the administration by name, and if I ever have a problem, I have most of their numbers on my cell phone. And that actually came up just a couple days ago. There was a patient I needed some administrative help with in terms of getting some mental health assistance on a patient with the MHMR group, and I just called up our administrator on call, and it really helped us take care of things with that patient. So overall, we have a good relationship with administration. We know each other by name, and I never have a problem getting in touch with them if I need their help.
West Texas is an amazing place to live. I'm, of course, biased being from the area, but as soon as I went into residency, I knew that this was an area that I wanted to come back and practice, and the main reason is for the patients. And our patients are amazing here. They're so nice, they're so kind and loving, and I love getting to know their stories and hearing about their families and hearing about their different experiences. They're always so thankful and so happy that we're able to provide care for them, and it just creates such a unique bond with our patients, and I don't think that there are nicer patients anywhere other than West Texas.
Everyone in Abilene is very nice, and I have had patients' family who stop by me at the grocery store and say thank you for taking care of my family, and everyone is very great to work with at Hendrick. So I make Abilene my home very quickly within months, so now I have a lot of friends and family here.
Abilene, first and foremost, is a great place to raise your family. I have 3 young girls, and we have a lot of opportunities for the children to be involved, and also a lot of opportunities for spouses to be involved. My wife is a physician as well, but she's also been able to take various leadership roles in the community on a volunteer basis, even becoming the chairman of the board of the United Way 2 years ago. So not only are the people friendly and welcoming, there are immediate opportunities to become involved in the community almost from the first moment that you arrive.
One of my favorite things about Abilene is that when I drive to work in the morning, it takes me 3 minutes to get here, and I have a lot more time beginning and end of my day with my family. It's a big enough community where there's plenty to do here. There's lots of good restaurants, and it's small enough to where it's easy to get around. I feel like it's safe for my kids to play outside. There's plenty of outdoor space. There's 3 universities. We live close to one of them. That's one of the places where we take our kids to let them play outside and run around the track and ride their bikes. So I think it's just a good combination of big enough to have plenty to do, but also has a small town feel to it.
Abilene has a unique access to the outdoors. In 15 minutes, you can be in the middle of the woods or on a creek fishing and be out of the concrete. Having spent 6 years in Dallas, it takes an hour and a half to leave concrete. And so we have unique access to all sorts of recreational activities. My family and I partake in all of those, from fishing to hunting to hiking and etc.
So we have plenty of activities here in Abilene to keep you busy in your off time. We have concerts that come in. We have different plays that come through. I have 2 small children, and we have lots of activities for them as well. We have the Abilene Zoo, and we have the Grace Museum. We have so many different opportunities that you will be able to do pretty much anything that you want. If there's things that aren't offered here, the Metroplex is not far away. My husband and I sometimes will take quick trips to the Metroplex to go see a concert or go to a sports event, and we're not far away. You can fly anywhere in a short period of time also, but here in Abilene we've got lots of things that come through locally as well. Abilene is a great place to live and to have a nice home. We have a very low cost of living here, so you can live pretty much anywhere in town. I live on the far south side of town, and it takes me all of 15 minutes to get to work. So even though I live on the opposite side of town, it doesn't take me long to drive to work. There are lots of very nice communities and residential areas around here. My husband and I built a home, and we were very fortunate. We had the support of some of the local banks here as well. They know that Hendrick employees are good employees, and they're a good investment, and so it was very easy just coming out of residency to be able to get a loan to build a house. And that's something that I know lots of residents are worried about, is where they're going to live. And so we have lots of opportunities to have a nice house, or if you want to live on a little bit of land, there are some other physicians that have a larger piece of land and are still able to commute into work.
Well, there's a couple large school systems in Abilene. There's Abilene ISD and Wiley ISD. And there's a couple smaller school districts where some people that live further out, like Jim and Ed, choose to go to school. We're in AISD. I have a daughter that's in 3rd grade at Taylor Elementary. It's right across the street from Abilene Christian University. We've been very happy. We think the teachers there are excellent, and our daughter has been challenged in the school system in a good way. And I actually grew up in Abilene as well, went through the elementary, middle school, and high school process and had a great experience. So did my wife. So we're very happy with the public school options, and we know people that go to private schools as well, and there's some good options there as well.
So some of the advice that I'd have for residents or fellows that are just coming out of training is really look at what type of practice that you want to have in the long run. You have had a really hard job for many years and with very little pay. And so there are going to be different communities and different opportunities that you have that first and foremost, you're probably going to look at what your salary is going to be. I know that that is something that's very attractive after having not made much money. You've got lots of loans and you've got family members to support. But in addition to looking at just what your salary is going to be, you want to look at the type of conditions that you're going to be working in, the type of community that you're going to be in. Is the administration going to be supportive of you? Are the nurses happy in the hospital? Or are they going to be disgruntled and calling you all night long? One thing that's been great about here is that the nursing staff is all so happy in their jobs, and they're always so happy to help out. They hate to bother you at night. Of course, they'll do whatever's best for the patient, but they really try to troubleshoot things, and they're really trying to work hard at their jobs, and they're happy at their jobs, and that says a lot about the environment here at Hendrick.
Be open to your options, and I think that Abilene is a really great place to make home. Hendrick is a great place to work with. I'm very happy with everyone I work with. And when you come out residency, you have a lot of options to go to big city. I chose to come here, and I will stay here for a long time.
I would say, we have a very dynamic group of young physicians right here. I anticipate in the next 3 to 5 years, this is one of the top facilities, for the patients to come here. So we would love to have you here, and I think this is a great place to work in every aspect. So I would encourage you to strongly look at Hendrick Health System.
We hope you choose Abilene for your new home.
Come join us at Hendrick, and I think that you'll love Abilene also.
We hope to have you join our medical staff at Hendrick.
Congratulations on being at the end of a long road, and we hope to see you here at Hendrick.